Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a Professor of Radiology at Weill Cornell Medical College. Well, cancer survivorship has increased over the last 30 years. The population of cancer survivors in the United States is currently around 17 million, which is about 5% of our population, and it's expected to continuously increase. And it's been estimated that cancer survivors have a 14% higher risk of developing a second primary malignancy compared to the general population. And among those cancers that these survivors get, lung cancer is the most common diagnosis. Now, lung cancer screening has been shown to reduce lung cancer mortality. The National Lung Screening Trial, known as NLST, in the United States demonstrated a 20% reduction in lung cancer deaths in individuals between the ages of 55 to 74 who had a smoking history of 30 pack years or greater and underwent low dose screening. And other studies, such as the Dutch-Belgian study known as Nelson, also demonstrated about a 26% reduction in lung cancer deaths at a 10 years follow-up. But in all these trials, patients with a prior cancer were either not included or some were included based on certain types of cancers, but they were not consistently included in screening trials. So aside from the risk factors, which include the age and smoking history, what we're saying is that survivors of cancer were inconsistently included in these randomized trials. Now, of note, we've looked at retrospectively at our population and published a paper last year in European Radiology, which did show that patients that have cancer have a higher incidence of screening detected lung cancer. And our incidence was about 6.4%. Now, that's not part of a randomized trial, it's retrospective, but compared to the percent that was seen in the NLSD, which was about 2.4%, and the Nelson trial, which was about 3.2%, you could see that that's a higher rate. So it's really would be very worthwhile to study this and have larger randomized trials that include cancer survivors. Because if they're cured from their cancer, they should be eligible to screen for lung cancer, just like we screen for breast cancer with mammography and also with colonoscopy in those that are cured from their cancer. Now, while we've demonstrated higher rates of positive screening studies in cancer survivors, we've also had higher rates of invasive diagnostic procedures in these patients with a prior malignancy. And the reason that is that these cases are harder to read, they're more complex. Because these patients have been treated with radiation or surgery or chemotherapy, the lungs are harder to interpret. So it could lead to a higher positive screening study and also to higher diagnostic procedures, which could lead to complications. So this is a very complex area, but it's certainly worth investigating, and we do need larger studies because these are certainly challenging studies to read and to interpret. And we don't want to accept rates of invasive procedures that are higher than acceptable rates or high false positive rates in these individuals. And as with all studies, there is radiation exposure from screening, and that's certainly something that also needs to be accounted for.